Looks like everybody's in good spirits today. I'm Chad Olin, Executive Officer at Pointe Coupee General Hospital. Thanks to everybody for coming out to celebrate with us today. Today, we celebrate 50 years of providing healthcare service to the Pointe Coupee community. In November of 1969, the Sisters of St. Joseph opened our hospital and began seeing patients. That initial hospital, was built with Hilberton funds. Those were federal funds provided with the one condition, that we would continue to see low-income patients and treat those patients for many years. We finished that requirement in 1990, but the hospital has continued that mission over many years. The board decided they never wanted to stop doing that. That is part of our mission and will always be our mission. Over the last 50 years, we've continued to grow and adapt to meet the needs of our community. We have a number of speakers today and people I want to recognize, but before we get started with that, I wanted to give the history of the hospital, and even going back before this hospital was built, to let everybody know just how this place came to be. In 1952, the Sisters of St. Joseph managed the Mosley Clinic on a trial basis in downtown New Roads. In 1953, the Sisters purchased the Mosley Clinic and changed the name to Sisters of St. Joseph Hospital. The Sisters of St. Joseph was approved the hospital was approved as a 26-bed hospital. For the next 15 years, hospital services were provided at that facility. In 1969, Pointe Coupee General Hospital, a 60-bed hospital building, was completed on Falls River Drive and managed by the Sisters of St. Joseph. In 1975, Pointe Coupee Health Unit was opened. In 1977, the South Complex Physician Suites were completed. In 1983, the North Complex Physician Suites were completed. In 1984, Pointe Coupee Homebound Health was established. In 1985, expansion of the emergency department in the ICU was completed. In 1985, the substance abuse en santé was completed. Pointe Coupee Council on Aging was relocated to the hospital campus in 1985. In 1987, a management agreement with Our Lady of the Lake was established. That continued on until 2001. In response to deteriorating financial conditions in 1987, the parish approved a half-cent sales tax. 10 years later, in 1997, our board decided that was too much, and they actually asked the parish for a reduction from 1/2 cent to 1/4 cent. Possibly the only public body that asked for a reduction in taxes. I don't know what we were thinking. In 1997, the therapy building and the home health building were completed on Hospital Road. In 1998, the internal medicine building was completed. In 2004, the hospital was granted critical access status, which provided for increased Medicare reimbursement. In 2015, Pointe Coupee General Hospital received accreditation by the Joint Commission on Accreditation of Healthcare Organizations. In 2015, our lab department and central supply storeroom was relocated to the newly completed 7,000 square foot building. In 2015, St. Joseph's Medical Plaza was completed. The 11,000 square foot complex is leased by Our Lady of the Lake Physicians. In 2017, the emergency department renovation to increase our capacity from 8 to 14 beds, along with a new outpatient registration, was completed. And only this year we completed enlarging many of our patient rooms to create a better patient experience. Our board, our 9-member board, has provided a big part of our leadership over those years. I want to recognize those board members today. I see many of them are here. Frank Fody, Mary Grizaffi, William Bircher, Anthony Hurst, John Pusho, our Secretary, Stephen Smith, our Vice Chairman, Maurice Picard, our Finance Chair, Donald Doucette, and our Board Chairman has served in that capacity since 2006. His leadership has proven invaluable to the progress we've made over the past 14 years. His elect physician has served our community for many years. Dr. McLemore is going to speak to us today, but he's still seeing his, oh, there he is. I want to introduce Dr. Carl McLemore, our Board Chairman.
We got a nice turnout. Let's see. So we've been here 50 years in the building. But you know, hospital is not just about a building, it's about all the people that make it possible, from everyone in the community that supports it, to all the staff that work here to make it work like it does. I don't know if I'll be here for 50 more years to see the next time, but the hospital will, the community will, and you know, as we go along, things change, and I think we've done a decent job about changing with the times, and hopefully we can continue that.
Next, I'd like to call up our past state representative and our first parish president, Major Tebow.
Thank you, Chad. I guess good afternoon. Doc kind of hit it on the head. I mean, I know when I was in the legislature representing you for 11 years, all we heard about was funding for hospitals, particularly our rural hospitals, the tumultuous political environment we're in, and funding for health care. It's not many places that have access to rural health care facilities. And in light of all the challenges that they've had from federal funding to state funding, this hospital over the last 50 years has survived. It's a pillar of our community. It's not only survived, but it's thrived. Continue to add programs, continue to add buildings and people, and I think, like Doc said, that's because of you, the people who work here now, as well as in the past, as well as your leadership, as well as the community that uses and utilizes this facility. We're glad to have you. I can tell you, in a parish, this is rural parish. This is one of the largest employers for the parish, so it's a strong economic base for our parish. And it's good to have a lot of the people who live here be able to work here. We want to continue that and support it. So happy birthday on the 50th year. Congratulations to each and every one of you. And I hope I'm still around in 50 years. But thank you.
Thank you, Major. We've always had a good relationship with our police jury in the past. Many of the police jury members were also our board members. Now it's a different form of government, but we look forward to working with Major and the new parish government. They're a good group, and it's always been a good, close relationship. Some of the other hospital administrators I talk to don't have quite the cohesiveness that we have in Pointe Coupee, so we are proud of that. Next, I would like to call up our state representative, Jeremy Lacombe. Jeremy has been instrumental for many years in raising funds for cancer patients through the Lacombe Foundation. The proceeds from the softball tournament and Couchon delay have provided much needed help to those suffering with cancer. The funds raised have become an integral part of our foundation. State Representative Jeremy Lacombe.
Thank you, Chad. Distinguished guests, I'll say a few more words than Doc did. I guess it's part of, you never put a microphone in front of a lawyer and expect him not to talk. That was a wonderful chronological history that Chad provided at the hospital. One of the things that stuck out to me more than anything is that the basis of the hospital was essentially started to help provide indigent care to people in the rural community. And even though that official mission, as he said, ended in, I think, 1990, it's never really ended. And from that, I have to say, from our family's perspective, I stand before you as a state representative, but also, I've only been elected for 6 months. For the past 19 years, our family has worked in close cohesiveness with the chair, the board, and the hospital through our work with the Janelle Lacombe Cancer Fund. What many don't know about the Janelle Lacombe Cancer Fund is it's actually named the Pointe Coupee Health Services Foundation. And the Pointe Coupee Health Services Foundation encompasses more than just the cancer fund portion that's named after my mom. It also encompasses and captures hospice care and some of the other things that goes into it. In 1999, my mother passed away from cancer, and our family started this fundraising endeavor. But in doing so, for about the first 10 years that it was in place, we donated the money to Pointe Coupee Homebound Health, and before it was even known as Pointe Coupee Homebound Health and Hospice. It was just Pointe Coupee Home Health and Hospice. And we did that because that organization, which falls under this umbrella of the hospital, services through home health services, mostly to patients in Pointe Coupee Parish, but they are expanded beyond Pointe Coupee, but certainly in our region. And through that relationship, they used the money, and we developed over time a closer cohesiveness. From that arose, through the leadership of past presidents of the Home Health and Hospice Organization, they saw a need that there was more to what we needed to do and provide than what was actually coming in. So they approached the board, and I think that the people here need to understand how amazing that is and how they're dedicated, not only Chad, but the board itself, how dedicated they are to providing health services here. We approached the board, and the board agreed to incorporate and put the Health Services Foundation together. They allowed for it to be a 501c3. And I know that a lot of people in here have been through the beginning and helped us with the cancer stuff, but they have seen over the last 10 years the amount of money we've raised grow tremendously. And that's not anything that we were doing any different. Obviously, it got a little bit bigger over the time, but it helped because it incorporated a 501c3 status into it. It allowed businesses and other entities to support our organization and reap the benefits. And I will tell you, we donated $64,500 from our softball tournament a few weeks ago to Homebound Health and Hospice. Last year we donated $52,000. But as you go through the course of time, it's been over $675,000 donated. Over 500 families have reaped the benefits. But it's more than just the 500 families. I'll tell a short story about what Chad and them did for us. 7 or 8 years ago, we lost funding. We used to get a grant from Susan Colby for breast cancer screenings. And those screenings was dedicated solely to providing mammograms for indigent women here in this parish who couldn't get those access to care, who didn't have insurance, who didn't have it. And the Coleman grant hit us hard because it was approximately $20,000 a year they used to give us strictly for these screenings. And for a small organization, we can't just make that up. That's several hundred mammograms a year. We went to Chad, and I said, Chad, we can't lose this. So many of these women have been doing this for year after year after year, and they need this mammogram. This is their only access to care. And Chad told me, he said, don't worry about it. We're going to figure it out. We're going to make it work. That's visionary leadership from a standpoint. He could have said to the bottom line, no, look, we just don't have it in our budget. We're not going to do it. He knew how instrumental it was. And that was not only his decision, but it was the board's decision. Working with this board has been the easiest thing that we have done from our family than anything. And it's because they still, at this point, service their original mission, provide health care and health services to indigent people in our community. And whether or not it's part of their official mission, it's certainly what they do every time I walk in this building and I go sit down with either Chad or John or Miss Janine or any of the other parties that are running this organization. We have a unique opportunity right now in the state of Louisiana. There's a huge debate going on right now with our governor's election in 2 weeks. what we're gonna do and how we're gonna continue. Medicaid expansion is front and center in that. And I will sit here and stand before you today and tell you that Medicaid expansion that was expanded 4 years ago in this state has helped this hospital. It's not been the end-all be-all, but it has helped this hospital because it has given us federal tax dollars back to the state of Louisiana to help indigents, working people actually, to help working families get access to care. This hospital provides that care. This is a major economic driver of our parish. It's one of the biggest employers we have, but more importantly, when somebody in Bachelor has a stroke, they're going to die if they have to be transported to Baton Rouge. They can be brought here and saved. If somebody's here in New Roads and they have a heart attack, they can get here. If they're in Photos, they can get here. If they're closer to Simpsport, they can get here. But they're not going to get to Lafayette. They're not going to get to Baton Rouge. They're not going to get to New Orleans. We have to fight to make sure that this hospital is financially viable going forward for another 50 years. It's too critical to our infrastructure in our parish not to. And when you're voting for governor next 2 weeks from now, 3 weeks from now, you need to look at that. You need to look at those decisions and say, what are we doing in healthcare in the state? What's happening? And I think that standing before you now, we have an opportunity to make sure that this hospital is viable and moving forward. I thank everyone here from the bottom of our hearts. Our family has worked as teammates together with this organization, with this board, with this CEO, and with everyone at Home Health and Hospice. We've worked very hard over the last 2 decades to make sure that people in this parish are taken care of. And moving forward, I have all the trust in the world that these folks are the most knowledgeable, most caring, and most dedicated people to the patients that walk through this door, but also to the community that they serve. Thank y'all, Chad, for everything that y'all do here. It is wonderful, and we look forward to celebrating hopefully another 50 years with y'all.
Every time I go to meetings at Louisiana Hospital Association, they're really big on Jeremy. They always ask about Jeremy and what a great job he's doing in the legislature. I guess they ask about Major a little bit, but they really ask about Jeremy a lot. You know? Not sure what he's doing. Jeremy mentioned the mammography. We installed a new 3D mammo unit. Anybody interested in taking a tour of that? Tess Jarrow is available to give a tour after we finish. There she is back there. We do have patients scheduled at 1 o'clock, so you'll have to go as soon as we wrap things up. After that, you lose your chance. So that's something we're very proud of. Although we are celebrating this building today, 50 years, everybody knows the real thing that makes this hospital such a great place is all of the employees. Every time we have quality scores, we're compared to other rural hospitals nationally, we always score in the top third. And that's not because of a building or equipment, it's always because of the compassion of the employees. So we're very proud of the employees we have here. Our turnover rate is probably half what the national average is for other hospitals, and that tells us employees really just like working here. They come here and they really don't move on to other hospitals. So we're very proud of that. Today we want to recognize those employees that have been here over 25 years. And I'm going to call them up and they can just come. Lisa is going to give them some plaques. Janice David, 25 years. Gladys Wright is 25 years. I am 25 years. Geraldine Darcy, 26. Paula Guidros, 26 years. Roxanne Jewell, 27 years. Linda David is 30 years. Yvette Garrett is 30 years. Dana Tolliver, 30 years. Wanda Demelan is 33 years. Gail Anderson is 36 years. We have one employee that has made over 40 years. She came in 1979. She works in the business office as a biller, Sandra Fouchot. We estimate over 40 years of billing claims that Sandra has probably billed $300 to $400 million of Medicare and Medicaid information. I challenge anybody to find a biller in the state that knows more about Medicare and Medicaid billing than Sandra. So, congratulations, Sandra. I want to recognize a past employee here. You've heard me mention the Sisters of St. Joseph many times. We have today here Sister Mary Ann Hebert. She was here in 1976 to 1978. She was an administrative assistant. She reported to the administrator or CEO. That's 2 years. I think she told me before that she went through 7 administrators. So I'm not sure what was happening back there, but 7 administrators in 2 years. I'm glad the turnover's not quite like that right now. But we're glad you came here today, Sister Mary Ann. Okay, this concludes our celebration. We have a reception in the Sisters of St. Joseph Conference Room. Right inside the lobby, we have many newsletters, scrapbooks, old medical equipment. You might recognize some of the people in all those old newsletters that you knew 40, 50 years ago. Thanks everybody for coming out. We appreciate you coming.